In the Black community, there is a negative stigma surrounding mental health. The community doesn't create a safe place for us to discuss these topics. Instead, we openly do not seek professional help for depression, anxiety, and other conditions we sometimes resort to. Or we isolate ourselves due to our health issues and they show up in our social behavior. We are masking our pain and comfortably living within it.
So before we go into the conversation, it's very important that we first define very basic definitions around mental health and mental illness so that we are all on the same page. So first, what is mental health? Mental health are health conditions involving our thoughts, emotions, and behaviors. That's one definition. Now, what is mental illness? According to American Psychiatric Association, mental illnesses are health conditions involving changes in thinking, emotion, or behavior, or it can be a combination of these. Mental illnesses are associated with distress and or problems functioning in social, work, or family activities. So now we have two basic definitions around mental health and mental illness so that when we enter into this conversation, we are all on the same page. So what defines mental illness? So mental illness is defined by basically a distress or a disability, something that is causing a dysfunction in your social life, your work life, family life that involves your thoughts, emotions, or behaviors. It first have to be diagnosed, it have to cause a disability, and it have to be persistent at a period of time. Mental illness can play a huge role in your ability to function in society at an adequate level. One, it can cause, basically because of the stigma that's associated with mental illness, and a lot of the stigma that goes into it, it's basically around the lack of education when we're talking about mental illness. So if you do have a mental illness, a lot of times you're afraid to even address it or acknowledge it because you don't want the backlash that comes along with it. And that can interfere with your social functioning, because if it's something that is causing you to not function at a social level, that's in result of your mental illness and you're not aware of it, or people do not understand what's happening, you can easily become a victim of bullying or stigmatization. So there are a lot of disorders that are associated with race and gender and socioeconomic status and environment. So specifically, I don't want to say that, African Americans on average are prone or most likely to be diagnosed with certain disorders, although research has found that certain disorders African Americans are diagnosed with, mainly because of when you have Caucasian practitioners who do not have a good glimpse of their cultural background and references, they may mistake certain behaviors as symptoms of certain illnesses. But I would not say that there are certain mental disorders associated with the African American community. So in the African American community, this is a very important topic that we're talking about, mental health, but more so why as a group of people, as a cultural group, that we're not really receptive to mental health services or even comfortable with talking about it. And a lot of that goes into the history of America and the relationship between the government and the African American community. So it can date back, like I said, to even the Atlantic slave trade or the Tuskegee syphilis study, where African American men were recruited and they were targeted because they were African American, they were of a low socioeconomic status. So the investigators provided resources that will meet certain basic needs. So they gave them, I think, a total of about $55. Don't quote me on it, but you can find it in the study. They provided food and water and transportation to these individuals for them to participate in this study, knowing that they were not going to provide a cure for the syphilis. So now you had these 50 or so African American men who participated in a government study and who were infected with syphilis but were not giving treatment or a cure to help them get through the experiment or the experiences of having syphilis. That can even tie into the mistrust or the relationship that need to be built with a clinician or mental health practitioner who may be Caucasian, because of the perception that goes into the government, and trusting them with certain studies is dated all the way back into the history of African Americans. So it goes into the stigma, and here stigma includes stereotypes, discrimination, and prejudice. Now we know what stereotypes are. Stereotypes are ideals about a group of people. Discrimination is acting on those ideals, and prejudice is believing those ideals to be true. So a lot of times when you're talking about mental health, because it's because it is negatively associated with violence and crime, a lot of people will not want to address the fact that they may have a mental illness, and that can be a stigma. And there are different forms of stigma. You have a public stigma, and public stigma is basically how individuals utilize stigma against other groups. I'll give you an example of what stigma is for public stigma. So it's basically how individuals use stereotypes and discrimination and prejudice toward a group of people. So if we have a group of students who may have mental illnesses, we cannot go and say, you know, all of you all are crazy or all of you all are violent. We're using that stigma to define a whole group of people. And then there's a private stigma, and basically that's the internalization of the stereotypes and the prejudice that are held by the people who are supposed to be understanding and sensitive around such a big, huge, important part of our life, which is mental health.
I would say one of the biggest barriers I've seen in working is the stigma associated with having a mental health disorder, being labeled, or thinking that people will think that you're crazy or of some sort. I think that's one of the biggest challenges, as well as poverty, things like access to care, access to good care. But again, I think the biggest thing with our community is stigma, and not to say that there's not stigma in having a mental illness across the board in all races or nationalities, but it's a huge barrier for people in the African American community.
Theoretical perspectives around behavior that people made so much sense to me and why they did the way that they did. But more so when I got into systems theory, I started to better understand poverty and violence that happened in my community. Because growing up, that is not really explained to you why we're living in the hood, why, you know, every corner there's a liquor store, why, you know, the grocery stores are like 6-7 miles apart from each other. And all of those are social determinants of our health and mental health. And then it was also, I don't know for you, but for me, in the my experience growing up in the African American community, being crazy was almost something that we wanted to subscribe to. It was like if we didn't show that we didn't have the ability to regulate our emotions, we was weak, or we was placed in the other or soft kind of category. So it was almost as if aggressive behaviors were promoted almost, and everything other was kind of like frowned upon.
But there was the good crazy and the bad crazy.
Absolutely.
Because you wanted to be like the crazy you see on TV with the baby mamas banging on the door, but you didn't want to be crackhead crazy.
Right.
So you had to figure out what your crazy was and
Absolutely.
get the right balance.
Absolutely.
Type of thing. So yeah, I can see that. But then that crazy label is also what created a lot of the stigmas and why people didn't want to seek treatment.
Now, come on, let's talk about the labels. Absolutely.
No, you have to think
absolutely.
about that and just say, well, you know, that was a while ago, and we've learned from that, and we no longer label people.
Right.
It's more about identifying the symptoms and what you're going through. So you're not depressed, you're living with depression. So depression doesn't define who you are,
Absolutely.
but depression is just something you're going through today, and tomorrow you can be a ball of sunshine.
Absolutely.
Just, let's figure it out.
Absolutely. So you mentioned that you are currently working in the mental health field, and you have done a lot of work around Black mental health in the Black community on those lines. So from your work and your expertise, what are some common health disorders in the Black community, and are they inherited?
So what we say is it's not inherited. The only thing that's generally inherited is substance abuse. But as far as what we see is diagnosed more often, because to be honest, it's all about diagnosis and reimbursement as far as insurance. So you'll see like major depressive disorder, bipolar 1 disorder, schizophrenia, and psychosis NOS for adults. If you don't see those four, it's because somebody really took some time and knew 12 years worth of history on you. And for kids, you'll have ADHD, autism, conduct disorder, oppositional defiant disorder, and then intermittent explosive disorder has been taken off for the past like 3 years, which is kind of a combination of conduct disorder and oppositional defiant, where you don't know why this kid just hauled off and punched you in the face.
Right.
So we're just gonna call it that.
Right. Okay, so throughout this season of mental health in the Black community, we will be exploring, as I did earlier, some of the stigmas associated, some of the factors that may be associated with mental illness. Also, it is our hope that we are providing you with tools that you can use in your own space so that you can create a safe environment to talk about such a convoluted and important topic of mental health. This has been your host, Dr. B. Stay tuned.